This is Kapelebyong as well. Hey. Others be. This is Kabera Maido. This is Kabera Maido from Kabera Maido district. Most of them are from Kabera Maido, as I told you in the presser, and Kapelebyong. Some few from Kalaki as well.
In that head office. You're all welcome and thank you very much. Thank you. Dr. Alfred Akali is here on behalf of the head enforcement, Mr. Samuel Chomukama, who, as he says, could not be with us today. Targeted enforcement operation in Northeastern region, Soroti City, February 6th, 2026. The National Drug Authority, NDA, has concluded a week-long compliance enforcement operation targeting illegal drug outlets in the Northeastern region, covering the districts of Kabera Maido, Ngora, Kapelebyong, Kalaki, and Soroti. During the operation, over 105 illegal drug outlets were closed due to various non-compliances, and in addition, 260 boxes of assorted classified medicines worth Uganda shillings 65 million were impounded. The major issues identified during the operation included operation in unauthorized, unsuitable premises, the operation of unlicensed facilities, and the use of unqualified persons to manage and dispense medicines. These practices contribute to the circulation of poor quality drugs, the irrational use of medicines, treatment failures, and antimicrobial resistance, among other public health risks. This NDA operation is in line with our mandate to protect and promote public health through effective regulation of human and animal medicines, as well as other healthcare products. National Drug Authority takes this opportunity to advise operators of outlets that deal in medicines, as well as those healthcare products, to formalize their operations and to visit our regional offices in Soroti City for guidance on compliance. NDA directs all unlicensed premises or operators to cease operations immediately until all licensing requirements are fulfilled, and reminds operators that the 2026 licensing cycle has already started, and this addresses licensing for both the renewing applicants and the new applicants for licenses. The general public is urged to buy drugs from licensed pharmacies and drug shops, and to report any suspected drug-related crimes through our toll-free line 0800 101 999, or to use our social media WhatsApp line, which is 0740 002 070. Your safety is our priority. Safe drugs save lives. Which districts registered the highest cases of non-compliance? I want to start by giving you a small background. These operations are no longer a case of running around in the field like headless chicken. We do surveillance and we plan very carefully. So based on our surveillance, we established that the worst offender currently is Kabera Maido district. And most of the cases of illegality came from Kabera Maido district. I think I've answered your question. We were able to retrieve 44 boxes of medicines from that district, from illegal outlets, and that is the highest number from the districts that we covered this week. It says that since the last operation, what are the levels of compliance if you compare the previous periods to now? I'll take you back about a year ago. A year ago we did an operation, and at that time we had about 884 licensed Class C drug shops. Currently we have 1,010 Class C drug shops, And we closed about 100 drug shops during that period. So you are seeing that the closed outlets are converting into licensed outlets. If you look at the number, the difference there is about 120 new licenses between a year ago and now, if you compare the numbers. I think that addresses your question, Natasha. Over the period from the previous operation to now. The last time, again, we were here, I'm going to take you back a little bit. Last time you were here, we had arrested about 12 individuals, including from Amukaro Market and from the illegally operating pharmacies. There were 5 at that time. So we have not registered any new cases apart from those 12 between last year and now. And these specific operations' major objective was not to effect arrests and prosecution. It is carrot and stick. As I told you in the previous engagement, that our objective is not to punish the operators. Actually, it goes back to Kenneth's question that how do we balance regulation and access? Because we know the areas where we are operating need the medicines, they need the services. So the major objective is to elicit compliance. So we are hopeful that the people we've engaged with and the facilities that have been closed are going to come to us and they're going to formalize, and we are going to eventually return these medicines to them in suitable premises and with qualified personnel. So ours is not to put people in jail, contrary to what the community thinks. Ours is to ensure ongoing compliance. The work plan and the budget for enforcement is limited, and as I said, we are doing targeted enforcement. We prioritize, based on risk-based approaches, the areas that we feel should be worked on first. It's like in the home, if you have 10,000 Uganda shillings, you cannot buy yourself a bottle of beer, yet there is no food in the home. So you first buy food. If you have any balance left over, then you can prioritize other issues. So the focus was to make sure that the most difficult areas are touched first as we plan for logistics and to handle other areas later. The region is composed of 19 districts, and we cannot handle them all in a single operation, so we have to prioritize some of those areas first. Arrests, routine operations, prosecution, all these things cost a lot of money. But before we come to an operation, there are other mechanisms that we employ, including stakeholder engagements, support supervision in collaboration with the district health teams. Really, enforcement is our last resort because, as you know, it's an expensive venture. So when we go into enforcement, we are dealing only with those cases that have refused to move, despite our best efforts. And as the representative for the head enforcement here will tell you, it involves teams from the center, it involves security teams from the Uganda Police, and as you know, it is cash intensive to execute an operation, even for just a week. So we only go into these issues only when it is absolutely necessary, and for only those cases that the region has failed to handle through routine licensing, support supervision, stakeholder engagements, which we do over TV, the media has been supportive, and through physical meetings in the districts. About the balance between regulation and access. Yes, one of the functions of the National Drug Authority under the National Drug Policy and Authority Act, which is the mandate law, is to ensure access at all times of safe, effective medicines to the people of Uganda. And we do this through balance. We are not robots. We don't just apply the law the way it is in its entirety without looking at the context. I'll give you an example. In the Karamoja sub-region, we have manyatas. You know manyatas? We have a few manyatas that are actually licensed as Class C drug shops in the spirit of ensuring access. And if a manyata is, they use cow dung to make the floors smooth, and they use the grass to keep the place cool. If that place can protect our drugs from the elements, then if the qualified person is there, we go ahead and we license. And we recognize these challenges as Kenneth has pointed out. We work with the government. The government is the major stakeholder through national medical stores for medicines access, but also in the private sector, NDA comes in to ensure that where some or all the requirements are not met, but the place needs access, that will provide access. It is the same in Namalu. If you go to Namalu, you will find some of these facilities which don't fully comply to the suitability requirements, but the qualified person is there, and we have closed one eye and in the spirit of balancing for access and licensed some of these facilities. Lydia, last but not least, has talked about the sale of drugs in markets as one of the trends. Yes, the northeastern region is a peculiar place. You have medicines being sold in shift markets. The popular markets like Amukaru, like Wera, Toroma, Chorimongin, Otuboi here, you find people with papyrus mats laying out drugs like their groundnuts. It is also very common. It used to be very common in Ochero, but it has reduced. So there are special operations targeting the markets as well. And I think we invited you to some of those operations before. And actually the biggest number of arrests are from the markets. Unfortunately, once we arrest and hand these people over to the police, the process is out of our hands. They go through prosecution, they are given punishments ranging from fines to custodial sentences, and once they have served their fines, they are released back into the system. And usually many of them return to the markets, unfortunately. That is why this work cannot stop. It has to be routine, it has to continue. And without divulging very many intelligence secrets, we are constantly planning and doing surveillance to curb the vice in the markets. Yes, thank you very much. I think these are the questions you asked. Dr. Kali can supplement
the press. Really, you have heavily answered the questions. I just wanted to supplement on the last question, I think, by Lydia, where she was talking about the sale of medicine in the market. We're just appealing to you, the media houses, that you should be our voice outside there and discourage the public from buying drugs from the market, because we're not sure of the quality, we're not sure of the people who are handling these drugs. Let our valued Ugandans look for a licensed drugstore or a clinic with a license issued by NDA, clearly displayed, with even a photograph of the person who is licensed to handle these drugs. We completely discourage you from accessing your drugs from the market. I know when they go to the market, they want to make sure they go back home with everything, but please stop buying these medicine, because first of all, they're exposed to the sunshine, like Thomas said. The people who are handling these drugs, we are not sure of their qualification. Many of them actually quacks. They are not qualified to do what they are doing. And you talked about the hard to reach areas, the landing site. We are also encouraging people who are qualified to take advantage of such areas. These days, it's difficult to get a job. If there's an area there where there's a gap of service, people who are qualified should run to those areas and open legal outlet which is licensed, so that the people of Uganda can access drugs from outlets that are actually that are licensed by NDA. That's what I wanted to supplement on what my colleague has said.